Thank you very much, Mr. Chairman. Ms. Bella, first of all, we want you to know we appreciate your good work, and Oregon especially because of the transformational waiver that we got where, in effect, we're going to be able to beef up quality at reduced costs. And as you know, Oregon has really financially committed to that agenda. That's why I want to examine with you where we are with respect to these demonstrations for the duals, because Oregon has come to the conclusion that it's not financially viable for them to be part of the demonstration. And they note, and they say this specifically, that your technical advisory group that you had for the duals, not one person thought as part of that technical advisory group that the system could work for a low-cost state with low fee-for-service reimbursement rates and high MA rates. So we now have this situation where there's no flexibility for a state like ours, where spending is less than the states that are here today, and in effect we're going to put at a disadvantage when calculating the baseline for these demonstrations the very states that are the future, the states that are most innovative and most creative, as you see with the application for our Medicare waiver. My sense is that you very much want to help states like ours, but that there is essentially almost a bias at OMB against these kind of innovative efforts. What is your thought about how we're going to get around this? Because if we're in a situation where your own technical advisory group says that the baseline support isn't going to work for a low-cost state, and you all, to your credit, are recognizing that we're in the vanguard, how do we get out of this vice?
We knew when we were developing these models that they wouldn't work for all states. And I think we have discovered that the financing for a low Medicare fee-for-service state such as Oregon, it's a challenge. And the health plans there look at what they receive today through Medicare Advantage, which is considerably higher than fee-for-service, or what they would receive through these demonstrations, and so we understand that. I think what we need to do, Minnesota finds itself in a similar position. We've been working with Minnesota on some administrative and regulatory efficiencies that don't address the payment issue at this point. Senator Wyden, we're early in learning, I think, in doing this analysis and validating the hypothesis as far as some of the challenges for a state like Oregon. And what I can commit to you is to continue working with the state to make sure that they have opportunities, and certainly opportunities that recognize the potential for quality and cost in that state.
I look forward to that, and I hope we can get this cleared out, because it almost undermines the initial thinking behind the transformational waiver. In other words, Oregon got that waiver, Oregon wanted to build the next step, and to face this kind of discrimination literally for doing a good job and doing a better job in effect than the states that got the green light just doesn't make any sense. You referenced a negative impact with respect to policy in the duals when you were here before about the multiple cards for Medicare and Medicaid. Last year, Senator Kirk and I, Senator Kirk of Illinois, introduced the Medicare Common Access Card Act. This is legislation that's been supported by senior groups, by the tech sector. It would upgrade the Medicare card seniors use by employing smart card technology, pretty much like the one that's used by the Department of Defense personnel. Would you have an opinion on generally the proposition of trying to move in this kind of direction, and the fact that this could particularly be a benefit to the duals population, given what you said before?
Certainly, we're interested in ways to use technology to streamline and make systems easier for beneficiaries. I'd be happy to go back and learn more about your legislation and then make a comment for the record.
Great. One last question, if I might. You also talked about state access to Medicare data. And I'm very much in favor of that, and the states are having to jump through hoops to gain access to it. Senator Grassley and I have introduced legislation that would open up the Medicare database, so that the public, free of charge, could have that information, and obviously that would be another way to get it to the states. Wouldn't that be, again, consistent with your philosophy of trying to empower the states to use this data?
We certainly are trying to do everything we can to put data and tools into states' hands, making sure we protect the privacy of the beneficiaries.
Very good. Thank you, Mr. Chairman.